I think infertile couples are surprised to learn that 40% of infertility is the male. It's almost half, and yet we think about women being infertile and women having babies. So it's a very common problem. It can be easily tested for because one of the cheapest tests we do is a semen analysis, which can readily tell us if the male has an issue. These men often go then to a urologist to investigate underlying causes of sperm issues, which can include a dilated vein or varicocele, as it's termed, a hormone imbalance, sometimes infection, or even a blockage, an obstruction. And those issues can be dealt with head on. If the sperm numbers are low and they can't be improved by the urologist, then usually we have to take that lower sperm count and deal with it. And one way is to, again, go back to insemination like we talked about earlier. If we can inject those sperm in the uterus, we can get them closer to the egg and help those sperm fertilize an egg. If the sperm numbers are extremely low, then we may have to inject the sperm in the egg to get it to penetrate into the egg and fertilize the egg. And to inject the sperm does require in vitro fertilization. That sperm injection process is called ICSI, which stands for intracytoplasmic sperm injection, which means to put the sperm into the egg. So those are the main treatments for male infertility. On a male's own, he can do a few things to maybe improve his cause. Certainly, again, like with the female, avoiding smoking is a huge boost to male infertility. Certain medications could affect male infertility, so he should review those with the doctor. Minimizing alcohol and caffeine would also be good, as well as an adequate diet. Heat is a problem for men, so jacuzzis and saunas and hot tubs, sometimes excessive bicycling can impact sperm parameters, so those are activities to be watched for. Beyond that, a good multivitamin, particularly with antioxidants and zinc, in some studies has been shown to improve sperm at least moderately. So these are some of the lifestyle things the male want to consider. But after a sperm count, if the numbers are very depressed, certainly a consult with a urologist would be the next step. Some men are workaholics and they're road warriors, and obviously that impacts their activity, their exercise, their nutrition. Laptops, if they're right on your lap and there's not a buffer, just the heat literally from the machine could overheat the testicles, much like a sauna or jacuzzi could. Drug use is not great for anyone, and in the case of fertility, marijuana really impacts sperm production and particularly sperm motility. We have some athletes too that unfortunately take anabolic steroids or male hormones such as testosterone, and that can drive sperm counts down dramatically, even to 0 levels. So again, anything you're putting in your body, if you're not sure it's okay, you should check with a fertility specialist to make sure you're not causing your own problem. But certainly lifestyle in this day and age can contribute to the high incidence of male infertility.